If it's so volatile, so dangerous in a dentist's hands, how on earth can it be safe in our mouths?
Marley, you got to understand how amalgam really works. If it's in a free form, the mercury that is in the amalgam is dangerous. But when it forms with the copper, the tin, the zinc, and the silver that make up the amalgam filling, it becomes a stable compound at that time. Once it is mixed and placed in a patient's mouth, it is a stable compound, and it does not constitute a risk.
Once it hardens,
correct,
it's safe.
Right.
What do you do with your scrap amalgam?
What we do in our own practice is we keep it in a jar that has glycerin in the jar. We pull the scrap in there and put a top on it. So it is not exposed in any way. It's in an airtight jar all the time.
Why? Given if it's...
That is the recommended way of taking care of it in a dental office. That is what's been recommended by the scientists. So that's the way we do it.
But if it's so perfectly safe in this combined state...
But Marley, you got to understand, when we're saving this stuff, we've got a big jar of it. You got to realize I'm in that office 5 days a week with this material. I do not want to go in there with an open container like that. I want to be as safe as I can.